Hello there, and welcome to the Physiotherapy Offer Holder Day experience. Whilst we'd like to have you on campus and we'd like to do this face-to-face normally, unfortunately due to the exceptional circumstances, we're now doing this as a virtual experience online for you. But hopefully you'll still find the experience useful. My name is Peter Ross. I'm the Senior Lecturer and the Admissions Tutor on the Physiotherapy degree programme, and I've probably met most of you during your interviews here at the University of Hertfordshire. So the aim of this little presentation that I'm giving and the one to follow is to give you a bit of an insight about what it's like to actually study physiotherapy here at the University of Hertfordshire. Hopefully I'll be able to highlight some of the differences and unique features about our course and how we teach slightly differently to other traditional universities. We're also going to have a little think about why you should choose University of Hertfordshire as your physiotherapy degree programme. And one of our physiotherapy student ambassadors has very kindly provided a little video clip of her thoughts and feelings and insight into why she chose to study with us. We'd also like to hopefully provide a bit of a snapshot of our scenario problem-based thematic style of teaching here at the University of Hertfordshire via a mini mock lecture during this presentation, and the following one look at some practical and some theoretical examples of how we teach things in our physiotherapy labs. Hopefully we'll be able to integrate a little bit of theory and practice in our mock practical session, and using hopefully the physiotherapy workbook that I provided for you, you'll be able to take part in this from the comfort of your own living arrangements. So what's it like to study physiotherapy here at the University of Hertfordshire? Well, we study all the relevant areas you'd expect to study at a physiotherapy degree programme. We look at the physiology, the anatomy, the pathology. We also look at the sociology, the ethics, the research, and look at kind of professional issues as well. But the way we teach that is slightly different. We use, as I said before, a patient scenario-based integrated thematic approach. And just to reinforce what that involves, it's essentially how we kind of package our information. And we use different themes across the kind of 3 years of our degree study. We use the musculoskeletal, the exercise, neurology, cardiorespiratory, and embedded all of those are research and interprofessional education. So for example, if we take the example of cardiorespiratory, we would actually teach you all about the cardiorespiratory system. We'd go through some of the disease processes and dysfunctions that can occur with the cardiorespiratory system. We'd look at the pathology, the physiology, but also start to look at some assessment skills and some treatment approaches, as well as thinking about the research that embeds within that and informs our practice. So at the end of that kind of block of study, if you like, you'd have the skills to go out and treat someone with a cardiorespiratory problem. And that allows us to bring forward some of our practice-based education quite early on in your career, so you can really kind of consolidate what you've learned in our practical and theoretical sessions. As I said before, we do use patient scenarios, and clinical scenarios that we've all worked with and patients we've managed are embedded within our modules for you to learn from as well. The other element slightly different about our programme is our research. The BSc Hons means that you've actually carried out some research element. The way we do that here is we carry out two distinct elements of research. We look at the kind of the patient's experiences and the journeys, and thinking about the kind of qualitative side of research, as well as the quantitative, looking at the kind of the experimental design and the lab studies. And we do this in small teams, so you'll be working with peers to kind of carry out these small projects rather than doing one big dissertation looking at one element of research. The other thing that's slightly different about our programs is this first year is our pass to procedure. And what that essentially means is that the first year is about you learning what's required at the university, looking at what you need to do slightly differently in terms of your learning and your ability to kind of carry out some of the assessment skills. So whilst you still need to pass the first year, the marks actually don't go towards anything in longer term. So it gives you a bit of a year to kind of step up to the level of what's required at university study. So a bit of an overview of the programme. You can see here I've listed the 3 years and the various modules that we teach. So you can see in the first year, for example, we teach the foundations of physiotherapy practice, which is an overview of lots of basic skills that we need to consolidate and embed within you before we can move on to some of the more kind of technical stuff. And we move on to musculoskeletal 1, looking at the musculoskeletal system, the bones, the joints, the nerves. And we think also about the cardiorespiratory system, looking at the lungs and the heart and the blood supply. Neuroscience is one. We focus much more on the neurological conditions, thinking about brain disorders, thinking about strokes, those kind of things. And we also have a specific interprofessional education module that you'll be carrying out and learning some of those core key skills with other kind of health professionals, such as occupational therapists and social workers. As I said before, because of our integrated problem-based thematic teaching, we can actually have some of our placements quite early on. So in the first year, we'll carry out 2 practice placements. The first one is a 2-weeker, and that happens just after Christmas in January, and our students come back really infused and refreshed and kind of see where the pieces fit together. We also have a 4-week placement at the end of that semester, around kind of May or June time, which is much more of a fully assessed module, and actually you look at doing much more kind of independent working, again still with supervision from your educator on placement practice. In the first year, there's also the opportunity to become qualified and register with the exercise professional body, and again level 2, and this is kind of built into your program, but there is a small additional 2-day course that you need to kind of carry out and do if you wish to gain that extra qualification. It's entirely optional, you don't have to do it, but about a third of our cohort do go on to do this. It makes you much more employable, it gives you extra strings to your bow, and gives you that expertise in exercise prescription, which a lot of employers are looking for. In the second year, we step up the intensity levels, we kind of look at kind of more complex situations, and you can see here this is kicked off with our complex care module, and musculoskeletal theme is carried on into the second year, as is our cardiorespiratory and neurosciences. So looking at developing and consolidating and expanding those skills and theories that you've learnt in the first year. We also look much more at research in the second year, picking up from a little bit of research that we do carry out in our foundations module. And again, we have some interprofessional education embedded throughout our modules, particularly in musculoskeletal too. And again, we have these placements kind of dispersed across the kind of 3 years of our program. So in the second year, we have 2 practice placements, about 5 weeks each in length. And again, that's something you can kind of really develop your skills at. In the third year, you can see our modules again are slightly different. We now have applied research, and that's that 2 elements, that kind of team approach that I talked about in doing 2 different elements of research to really give you a broad overview of what's required from research. We have physiotherapy practice and health and social care, looking at some of the more kind of unique or niche environments that physiotherapists work in, and the kind of more specialist areas such as arthritis care and obesity that we need to kind of develop your skills in. Advancing practice is a kind of catch-all module where you cover elements of all 3 of the other themes, so musculoskeletal, cardiorespiratory, neurosciences, but they're much more meshed together. So rather than working on one problem in isolation, you're perhaps dealing with someone that's had a stroke and has got respiratory problems as well. And again, you can see our interprofessional modules there again, as well as our practice placements. And in the third year, we expand these, so you have 3 practice placements, moving you much more towards autonomous clinical-based education. And again, there's also the option of getting another additional reps qualification. This one is entirely built into your program. There's no kind of additional module to do. This is kind of, you do it without even realizing it, but again, you do have to have reps level 2 in order to gain that reps level 3 qualification. So how do we teach at the University of Hertfordshire? Well, approximately 2/3 of the contact time is at university and is based on the College Lane campus. And again, we use the usual variety of teaching techniques, lectures, tutorials, seminars, lots of practical sessions. And actual fact, in the first year, we don't spend too long at all in those lectures. We do a lot more small group work and practical work. And we also make use of our simulation centre, our high fidelity simulation, where we have interactive mannequins that can respond to us in our simulation centre, which is set up to mimic various environments. Lots of group work, and again, working together is key, as well as the practice element. This is a practical profession, and our students do lots of practice together in various guises. So assessment and support, well, all our modules are credit rated. They will have a credit assigned to them, and that goes towards your degree classification in the second and third year. And we use a whole variety of different assessment methods, from the traditional essays and written exams through to the kind of practical exams and the oral kind of vivas that you discuss information with the educator or the clinician, as you would on clinical practice placement, as well as obviously our group work and our posters. All these different things are assessed at different levels. So hopefully you can find something you really excel at and do particularly well on, as well as perhaps those areas that you may need to work on a bit more. We have very strong support services at UH, not only from the personal tutor system, which again, everyone that comes here is allocated a personal tutor, someone like myself, that will get to know you slightly more and spend more time with that pastoral support as required, and having an overview of your education across the 3 years. But we have specific services. Our student wellbeing services are well developed to try and encourage and support students no matter what issues they may have, be that physical disabilities or issues, mental health issues, social issues. They're there to try and ensure your success, and we really look to try and work with our students to teach in the best way we can to ensure that they do well in this programme. We have very diverse cohorts, people from different walks and backgrounds, from ages, different careers, people come straight from college, and different kind of cultures and ethnic backgrounds as well. And it's really quite a supportive environment to learn and work in. And our students do really get on very well together. Lots of our staff are still in clinical practice, and that's really good because it brings you up to date new information that's being used out there with patients, and keeps our course new, up to date and refreshed and kind of current. And as you'd expect, lots of internationally renowned experts in their fields work for us and are involved in your education. I mentioned the clinical practice placements earlier, and as I said before, there are 7 scattered over the 3 years of the course. We won't spend too long on this, if you've heard this before, and also during your interviews. But again, we do go out in the first year, which is sometimes quite unique now in physiotherapy programs, and it's definitely not an observational placement. You're out there treating patients because of the way we teach. You have those skills to do that. We cover a whole variety of specialities and different sites across the southeast and east of England, so you get a whole variety of different ethoses and kind of visions and how different departments work to really encompass into your education and make you a much better clinician. Also, all our students are visited on practice placement, which again is sometimes quite unique, and I think University of Hertfordshire are one of the few remaining universities that do this. So every placement you go out on, a nominated visiting tutor will come out and see you to check that things are okay, to support you and your educators. And of course, the one visit is the minimum. We may be out more if we're required to do so. So hopefully it gives you that kind of confidence that you are well supported on placement. So moving on, again, our employment statistics, our national student survey is something I need to mention and you need to be aware of certainly. Those metrics are quite important when thinking about your degree programme, but perhaps more important from my perspective is you need to choose somewhere where you think you'll be happy for the next 3 years of your life, and also where you've had those experiences that can reassure you that this university is for you. But again, you can see that some of our statistics are quite impressive. Our graduation and kind of employment rate afterwards is impressive. 100% of our graduates go on and get jobs in physiotherapy 6 months after qualification. Our graduates are really well sought after out there, and clinicians really want them to join their departments. And you can see here some of the other statistics are also equally as impressive. 97% of our cohort agree that staff are good at explaining things. Feedback is there for our students. 97% said it was clear how that kind of feedback from the students had been acted on by the lecturers and the team. And again, we've had lots of opportunities to work with other students. So again, our metrics are up there with the best in the country and kind of put us on a par, really. So students give us lots of comments and feedback, and this is stuff that has actually come from the students. This is not made up. I've not just wrote this out for the benefit of this presentation. This is actual feedback that's come from our students, and again from both our first years, second years and third years. So I'll give you a moment just to have a little look at what they've said about us, our students. And again, I think you'll agree, actually some nice comments here, but don't just take it. Let's have a little listen to one of our students giving you their perspective on why they chose the University of Hertfordshire.
Hello everyone, I'm Kira, a second year student studying physiotherapy at the University of Hertfordshire. Today I've got a presentation talking through why I chose to study at UH, but also some experiences of what it's like to be a student there. One of the reasons I chose Hertfordshire Uni was the way they structured their course. They break it down into modules, and that just worked better for me in terms of the way I learn. As well as this, all of our learning materials are available on StudyNet. So StudyNet's an online portal that you can access through your laptop, or they actually have an app on your phone. And that's been really useful when it comes to revising for exams, to have all those resources in one place. Placements in first year, so we go out on a short 2-week placement, and this gives you a chance to get used to the clinical setting. start working with the multidisciplinary team and using those practical skills that you've learned early on. Campus, so Hertfordshire is actually split into two campuses. You've got College Lane and you've got de Havilland, within walking distance of each other, but there's also a shuttle bus if you prefer. With Hertfordshire University, you've also got the opportunity to stay on campus for all years. So I'm a second year now, and I stayed on campus for my first year and second year, and I plan to stay on campus next year for my third year. And you've got the campus security and resident assistants to help you whilst you're on campus if you need. Lots of support, so you've got the student support centres on College Lane in the Hutton Hub, but then also from the physio department, the lecturers have an open door policy. This means that at any point you can go in and speak to your lecturers, ask them any questions, and just get that extra support if you need. If you're not on campus though, you can always contact them via email. They're always really good at replying. As well as this, you've got the library, so you've got a library on each campus, College Lane and DHAV. These are the learner resource centres, and they are equipped with lots of laptops that you can actually take out on loan if you want to, as well as computers, printers, and then they've got study rooms, so you can have private study rooms if you want to just lock yourself away and get on with an essay. Or you've also got group study rooms that you can book out and work in a group if you want to go through some revision or if you've got a group project to do. There's always something to do on campus, so you've got Freshers' Fairs, you've got the summer ball, the Christmas ball, but as well as this in the physio department, you've got the Physio Society, which is run by us students, and we organise social events to do throughout the 3 years as well. So with the physio degree, they also offer additional qualifications, including the REPS course, so that's Register of Exercise Professionals Level 2. I actually did that in my first year, and it's really good because they've actually matched up the theory content from that qualification to what we're learning on our degree anyway. So the only extra work you have to do to get the qualification is going into the gym, learning the equipment, how to set it up, and then working through an exercise program with a partner. So I found that really useful to have. As well as the reps, they also offer massaging courses and taping courses throughout the 3 years as well. So yeah. So from my experience, what I've enjoyed the most and what I feel has actually benefited my learning has definitely been patient experience. So throughout first year and second year, we've had the opportunity of real patients to come in and talk about their experiences. So how being diagnosed with a certain pathology has impacted their life, what challenges they've had to overcome, any changes they've had to make, and we've had a wide variety. So in second year, we had an amputee come in with his physiotherapist to talk through his journey and how he's progressed to walking without crutches. That was a really good opportunity to actually be able to see the physio with the patient. We also were able to see a physio assessment on a paediatric. So we had a baby and his mum come in, and we were able to watch one of our lecturers give an paediatric assessment, which was really beneficial to see how that happens. We've had patients come in groups to talk. We've had parents of a little boy with Duchenne's muscular dystrophy come in, and it's been really beneficial to be able to link in the theory that we've learned in the classroom to that practical experience and patients, and it kind of consolidates, and it has consolidated the learning for me. We've also got a hydrotherapy session in third year, so I look forward to that next year. But in terms of my experiences so far, we've had the stimulation suite and interactive mannequin session. So this is where we go down to the sim centre with our lecturers in smaller groups, and it replicates an intensive care unit and a ward setting with mannequins as the patients. These mannequins can have elements changed about them, so their observations can be adjusted by our physios to replicate what would happen in a real life situation when we were applying some of our techniques. So that's a brilliant opportunity to be able to learn what to do in those changing situations. We've also had trips to the anatomy lab, so this was really good in first year for my learning. We went down to London and we were able to see cadavers cut up, and we were able to move different aspects of the body, so we could see where the muscles attach, how they interlink with one another. We were also able to feel as well, so to feel like what muscles felt like, and able to see arthritis in the knee. That was really interesting. There's been lots of chances over the first year to volunteer at marathons, help out at Wonder Wheels, and lots of different events. On the presentation you'll see lots of different aspects on there, but I would like to go down to ambassador opportunities. So I am an ambassador for the physiotherapy department. This has been brilliant. I've been able to help at open days and interviews as well, and being able to help out with the interviews have given me life skills of what to look for when you're interviewing someone, but actually on the other hand what to be able to do in an interview to get yourself noticed, and then to meet some of the upcoming candidates for next year. Also, we do a first year welcome event, so that's all 3 years. We go along to one of the halls on College Lane, and we have a breakfast, so you've got pastries, tea, coffees, and it's a chance for the third, first and second years all to mix, and you're also allocated a buddy system. So this is specific groups that are allocated of mixture between first, second and third years that you can contact at any point. You can ask them questions, ask them for advice, and that was really good in first year to be able to ask the second year how they cope with the change, how they managed to submit an assignment, and just different questions. So yeah. So you've got lots of things to do in and around Hatfield. You've got the Galleria, which is only a short walk from both De Havilland campus and College Lane. This is a large outlet shopping centre. You've got the Odeon Cinema in the Galleria, as well as lots of restaurants, some of which offer student discount for a cheaper evening. You've got the Forum, which is on College Lane. This is the largest entertainment complex in Hertfordshire, and holds a variety of different events of guest speakers, award ceremonies, and then a bit later on I'll talk about clubbing and a night out. You've also got the Hutton Hub, which is the student services on College Lane. So you've got a bank, pharmacy, GP surgery there, juice bar. You've got your student help desks and wellbeing centres. You've also got the sports village. So on De Havilland campus you've got the big sports village, which has an excellent gym. It holds classes, it's got a swimming pool, rock climbing facilities, and is, as it says on the presentation, often used by local, national and international team as training camps. But also on College Lane you've got a 24-hour gym at the Oval. And then also upstairs in the Oval you've got a studio which holds lots of active student sessions. So they run Zumba, yoga, Pilates, HIIT sessions, boxercise, wide variety that anyone can go to as long as they're a student. It's free. And then St Albans, so short bus journey away from the uni. You've got lots to do in St Albans as well. You've also got London, which is a 15-20 minute train journey. There's also buses all the time from the campus to the train station. You've got the Ellie House, which is the university pub on College Lane, and they offer discounted food and drinks as well as social areas for like pool tables and watching the football. In terms of nights out, the forum which I spoke about earlier, which is on College Lane, is the main night out on campus, and we have different events on, so you can have paint parties, UV parties, silent discos, and you can find all of them out on the Student Union website. So that's it in terms of my experiences. Thank you all. Any questions, do get in contact with the university team. Thank you.
Okay, hopefully you've heard that's made sense from Kira there and has given you a bit of kind of information as to why to choose the University of Hertfordshire. Let's move on now. Let's have a little think about one of our kind of examples of our integrated scenario-based thematic teaching. So we're going to carry out a really tiny, quick, mini kind of mock lecture, if you like. So thinking about what we're going to do, how we'd do it in one of our lecture theatres, give you a taste of what it feels like to be on the other end of the teaching, as it were. So I'll put the camera back on now. There we are, I'm back, and we're going to make a bit of start. So we're going to think about using one of our case scenarios. So if you can access that kind of workbook that I've put up online for you, that might be quite useful as it's got the information in it that we'll work through now based on this case scenario. Mary, who's actually a lady I have treated, who I am still working with, that actually is now kind of making good progress. But we'll start from the beginning and show you how we teach this to our students. So if you've got that workbook, please open it up, access it, and you can follow it as we go along. So we give our students a base kind of scenario, if you like, to start with. So this is Mary. Mary's a 75-year-old lady. And this is kind of some of the background we get from our patients when we first start to see them, be that on the ward or in an outpatient setting. So Mary has a history of present complaint. That means what's actually going wrong with her now. She's had peripheral vascular disease, or PVD, which has been diagnosed 10 years ago. So again, we need to think about the problem aspect here and think about what kind of issues we need to learn about our students, and that will be a big one. The present complaint, the reason why she's gone to see her doctor, is she's been complaining of increasing numbness in her lower leg and foot, as well as weakness. She hasn't got the same power she used to have, as well as it feeling a little bit strange. On examination, so the examination that's been carried out by the doctor or perhaps by us as physiotherapists, we can see that her foot is quite cold, it's cool and it's pale, and it's certainly got decreased sensation. So when we're kind of looking at sensory tests, we can see it's not quite the same as it usually is in a normal limb. And the muscle power is also quite reduced. Of note, she has a drug history of, this is again kind of drugs that be prescribed to the patient by the GP perhaps, of metformin and simvastatin. So again, our students would need to learn what those drugs are and the interactions and what they mean for a patient. So for our purposes, metformin is a drug that helps to control diabetes. Simvastatin is a drug that helps to control cholesterol levels. And we can see from her past medical history, she has indeed got type 2 diabetes. And this is the type of diabetes that comes on later in life and is often related to lifestyle or diet. She's also got this peripheral vascular disease I mentioned before and high cholesterol levels, hence she's on the simvastatin over here. She's had recurrent chest infections in the past, and she's also had a previous bypass graft to revascularize her right leg. So that would indicate that actually the blood supply to her limb has not been the best in the past, and she's had a surgery to try and improve the blood supply by putting in another tube to allow the blood to divert around blockages to help get the blood down to her foot. So again, that's happened in the past. The fact that she's come back with some issues now might indicate that actually that's not working anymore. It's something our students would need to think about. She has a familial history, so her mother has diabetes and her father died of a heart attack or a myocardial infarction. And often these heart attacks are caused by blockages in the arteries that feed blood to the heart. So again, I'm starting to think, and our students would think the same, is this the same process as is affecting her leg? Has she got blockages in the arteries to her leg? Again, the same as perhaps her father had in her heart. They kind of go hand in hand sometimes and follow on. You can't quite see this here, but I'll push this to the side in a moment. You can see from the social history she lives with her partner, who is alive and well and fit and well, but unfortunately she's got quite a big smoking history, Mary. She's been smoking since 15 years of age and she smokes 35 cigarettes a day, and that continues. So that's kind of the base scenario we'd work from, and our students would go away and think about some of these problems, and we'd help them learn some of the issues and some of the theory behind this, as well as the practical applications and how we might manage them. So what we might start to think about, say, is identifying all the unknown concepts and problems of the case scenario. And we teach these to our students, and they go and do some independent study and some research to find out the information themselves and feedback in groups or to us, for example. So with Mary, for example, the big one we might start to look at in a lecture scenario would be to look at that pathology, perhaps the physiology as well. So the pathology being the kind of the causation and the background to that disease process. So the peripheral vascular disease that I mentioned earlier, can you see? That's the kind of key thing we might start to look at and analyse and kind of drill down into. So for these purposes, I'll give you a brief outline of what that is. So peripheral vascular disease is mainly a disease of the large arteries that feed the ends of our body, and it mainly affects the larger arteries. And what tends to happen is these arteries get furred up or blocked, and again, that stops the blood from getting down to the limbs. The technical name for these is stenoses, when it starts to narrow, or complete blockages, which are occlusions, and that means the blood can't get to where it needs to go to, and those tissues beyond that point start to suffer. And we can break this down further and look at the pathological processes that actually cause this. So there are two main things that cause peripheral vascular disease. We have the arteriosclerosis, which is the thickening and loss of elasticities in the arteries. So as the arteries want to kind of squeeze and compress and open up to allow the blood through, that elastic ability is limited, and actually they can't really squeeze to push the blood down to the tissues that need them. And that's often caused by impregnation of calcium salts in the vessel wall. The other process that goes on is atherosclerosis, which you may be more familiar with. And this is laying down of fatty plaques, or atheromas they're called, in the arterial walls. And again, by laying down more and more of these plaques, there's less room for the blood to get through, which causes a decrease in blood flow down to the limb that needs it. So again, we can see here from the pictures how we can see fatty plaques building up on the vessel wall here. Can you see? Reducing the lumen size for the blood to get through. This side is unaffected, a clean artery with no atheromas. Here we can see the plaques, the atheromas are starting to build up and narrow down the lumen. And sometimes these plaques can actually burst and bleed into the vessel wall and cause more problems for the blood flow. So we can see that things become quite complex for our patients with peripheral vascular disease. Okay, so now we've looked at some of the pathological process and what actually happens. What we need to now perhaps is some of the anatomy and look at what causes this and why this is happening for the patient. So you may have done biology or PE at school or some form of science. So just for a moment, just try and think about the anatomy of the blood vessel. Can you label these structures? So what's this part in the middle called? What's this wall here? What's this big section of the wall and the outside lining of the wall, if you like? So this is the cross section of the artery. So just for a moment, see if you can work out what these layers might be called. Okay, so let's give you a bit of a hand here. So the first one is called the tunica intima, and this is the inside lining of the artery or the blood vessel. In here is the lumen where the blood flows through, and this layer is very thin, made up of endothelial tissue. So it's quite narrow, quite slender, and actually doesn't cause much of a blockage to the blood flow. However, this is where the plaques tend to grow around the side of the blood vessel and intrude into the lumen themselves. The next layer, if you like, of the blood vessel moving outwards is called the tunica media. So it's kind of the middle part. And this you can see is much thicker. This area here has much more muscle content and also elastic tissue. So that's the layer that actually compresses the artery and squeezes in pulses, in rhythms, to try and push the blood through the blood vessel to where it needs to get to. So this is kind of the muscle and the elastic layer. This final outer layer here, this is called the tunica adventitia. And this layer is made up of kind of tough fibrous tissue. This gives the blood vessels the rigidity, if you like, to hold firm against external pressures. For example, when you bend your leg, the blood vessels don't collapse. That's because this tunica adventitia is quite rigid, or fairly rigid, and resists that external pressure. So we'd revise the anatomy of the blood vessels, both the arteries and the veins, and perhaps think about the differences between veins and arteries. And we can see on this side here, on the left, the red one, the artery here, we can see the same cross section, but the vessel wall is much thicker, lots of muscle elastic tissue in here, whereas the vein, this layer is quite small. Can we see the difference? So the middle layer is quite small here, the outer layer is much more tough and fibrous. And of course, the other issue we have with veins, they have valves in the middle of them. We can see the valves here. Can we see each side, which prevents the blood flow going backwards? So again, differences between arteries and veins that again we get our students to kind of look for and learn about. Now look at some of the risk factors here. We can see perhaps some of the risk factors that lead to peripheral vascular disease in certain populations. Can you perhaps have a guess at what they might be? Have a little think of what might lead us to this disease process that limits blood flow to our limbs. Well, it's sometimes some of the kind of things you might expect, the kind of the big nasties, if you like. So smoking increases the risk factors for peripheral vascular disease. Smoking actually affects the linings of the blood vessels and makes them more permeable, so those fatty plaques tend to stick and coagulate together much more and cause blockages in our arteries. Increasing age, our arteries are less resilient, they're less flexible, and that can cause problems with our vascular supply as well. Cholesterol, high fat in your diet, can also lead to more fatty plaques being laid down and the consequences becoming much more significant, as can high blood pressure. A sedentary lifestyle and obesity. Again, unfortunately, our population is becoming more obese, we're becoming less active, and this is leading to an increase in peripheral vascular disease, which can cause some quite serious consequences. Similarly, low socioeconomic status here, those people that perhaps haven't got the ability to access healthcare as much as other people, or perhaps haven't got the education or the funds and resources to participate in a healthy lifestyle. Have they got the ability to kind of buy healthy food and prepare it, for example? So all of these risk factors, make the likelihood of peripheral vascular disease much more real for some of our populations. So what's the outcome? What's the consequence of this? Well, unfortunately, we can see that actually blood supply getting down to the feet or the fingers and the toes and the hands can be quite limited if there are blockages higher up in the arterial tree. So we can see quite clearly here, for example, how we can see different colours in the patient's feet. Can you see? And this might be Mary. So you can see here one is quite nicely perfused and red, and this side over here is quite pale, indicating insufficient blood flow. So again, that's quite an issue that we need to kind of look out for. And this can lead to gangrene, what we call necrosis, which essentially is when the tissues start to die, and that can lead to amputation. Not only does it cause problems to our extremities, the poor blood supply, but also blood supply to the vital organs can be affected. As we said before with Mary's father, he had some heart attacks because he had potentially poor blood supply to his heart. It could be the same for the kidneys, for example, and people suffer from kidney disease and renal failure because the blood vessels aren't supplying blood to those critical organs. And not only the organs, but also the nerves can be affected. Like any other soft tissue, nerves need blood supply. If we don't have a good blood supply to the nerves don't work so well. We have this issue that we refer to as peripheral neuropathies occurring. And this is where we tend to lose sensation in the extremities, in the fingers and in the toes and the foot, where the blood supply is not sufficient to keep the nerve working. And often in patients with peripheral vascular disease or diabetes like Mary, they have this stocking and glove distribution. So if you imagine when you put a pair of socks on or your gloves, those kind of areas don't work so well in terms of the sensation. And if you think back to Mary's case scenario, one of her symptoms was she was feeling much less sensation in her feet. So that kind of rings alarm bells that maybe her peripheral vascular disease is getting worse and escalating. So then we might move on to think about treatment of our students as well. What are the options in terms of management for physiotherapy? Management in terms of the medical approaches. How can we manage her with medication, for example? Are there surgical interventions that perhaps our doctors, the surgeons might consider to try and improve this patient's prognosis or their outcome? So we'll actually start to have a little look at some of those in our next presentation, specifically look at the physiotherapy interventions, because obviously the surgical and the medical, we can't look at too much in this presentation today, in this experience, but again, that's something we'd work with our team, the multidisciplinary team, to try and coordinate and see what's the best approach for our patients. So again, using our workbook, what we'll do later is to look at kind of the anatomy of the lower limb. We'll think about some of the physiotherapy assessments, and we'll also look at some of the physiotherapy treatment options. So again, that will be using our workbook, and we'll look at that in the next presentation. If you haven't got any questions at this point, or any questions in the future, don't hesitate to give me a call on the drop me an email on the Physio Admissions email account, and of course we'll get back to you. But thank you for listening and watching this presentation, and hopefully you'll join me in the second presentation when we look at some of the practical applications and what we do as physiotherapists to give you an insight into how we might manage someone like me. Here is some useful information. There's some websites here you can go to. I draw your attention particularly to these YouTube clips. These are quite helpful because some of our students and our graduates have actually created these for us. So it might be worthwhile taking a little bit of time at some point to have a little look at their clips. They're only a couple of minutes. The top one here is much more of a kind of a promotional video that we've produced. The other two have been made by our graduates and our students to kind of give you some insight into their kind of thoughts about the physiotherapy programme. You can also look at the Chartered Society of Physiotherapy for some information, as well as the NHS Healthcare Careers website. Okay, I'll see you in the next presentation, everybody.